the people who enter after this, right? Bujo?
Ma'am, only host or co-host can do it, ma'am.
Co-host cannot enter. So you can be the host and make me the co-host, because the students who enter after this cannot join the class. Okay. Right. Okay, good morning, class. I think you all have met me in the orientation if you were present at that time. So today's class is going to be a little short because we are not covering any topic today. So this will be the introduction to obstetrics and gynecology only. Am I audible?
Yes, ma'am.
Okay.
Yes, ma'am.
Why I cannot? The slides are not moving. So today's objectives are to be familiar with the terminologies in obs and gyne, because we'll be using these terminologies quite often, and you should be familiar with all these terminologies. And I'll just give you a format for history taking and examination, which I think when you will be posted in gyne obs, you'll be given again, but it's better to have an orientation. And we will also overview the topics which will be covered in this year, third year. Okay, and some common diagnostic techniques used in gyne obs. We'll just see the names of these diagnostic techniques, and common surgeries in OBGYN, just the names, not the procedure. And Sachin, can you ask everybody to keep their video on so that I can randomly see you? Okay, keep videos on, okay? If the students don't keep their video on, you keep them in waiting room, right? So what is the meaning of gynecology? By this time, I think you have some idea about gyne and obs, but then still, gynecology comes from the Greek word gyne, which means woman, and logos means study. Okay, so this is the study of the female genital or female reproductive organs and their diseases, right? And it also includes early pregnancy up to the age of viability, that is 28 weeks in our country. It may be less in other countries. Okay, and it also includes family planning methods and also infertility. Okay, this is clear. The students are disturbing now. And what is the meaning of obstetrics? It comes from a Latin word called obstetrix, which means midwife. But it covers more than midwifery. But this is an old terminology, so it is the same nowadays also. And obstetrics is concerned with reproduction, and this is the branch of medicine that studies pregnancy, labor, delivery, and puerperium. Puerperium means the period after delivery up to 6 weeks. And it studies both normal and abnormal conditions of all these four conditions. Now, what is birth or delivery? This is the complete expulsion or extraction of a fetus after the age of viability, that is 28 weeks in our country, or if the age of viability is, age of gestation is not known, then we take the weight of the baby. If it is more than 1000 gram, it is considered as a birth or delivery. Okay? And what is live birth? This is simply a birth of a newborn with sign of life, such as respiration, heartbeat, or movement of the body. Is stillbirth means birth of baby with absence of signs of life. Okay, so that stillbirth can be fresh stillbirth when the death has just occurred um, before the delivery, and macerated stillbirth means the stillbirth which has occurred a long time before delivery. Okay, and a term known as neonatal death. It is the death of newborn. So, what is the duration when we consider as neonatal death? Early neonatal death, when there is death of a live born neonate during the first 7 days after birth, that is early neonatal death, or late neonatal death, when death occurs after 7 days and up to 28 days of birth. So, totally neonatal death means death up to the age of 28 days after birth. Sachin, please tell them to put their video on. Please. I think everybody is keeping their video off. This is just like a physical class, okay? You cannot put your video off. Everybody, please. And Sachin, if they put off their video, make them absent. And perinatal period is the period after birth of baby up to 28 completed days. Okay, that is perinatal period. And perinatal mortality rate is the number of stillbirths plus neonatal deaths per 1,000 births. Okay, we count the total stillbirth, and add with total neonatal deaths, then per 1,000 total birth. That is perinatal mortality rate. That is one of the indicator of development. Okay, and total duration of pregnancy. What is the days of total duration of pregnancy on expected date of delivery? That is 40 weeks or 280 days. If you don't understand, please you can put it on the chat box, okay? Or later on we can have question answer. Now regarding the neonate, newborn is known as low birth weight if birth weight is less than 2.5 kg, and very low birth weight when it is less than 1500 gram, or extremely low birth weight when it is less than 1000 gram, and normal birth weight is when it is more than 2.5 kg or 2500 gram, right? And there is large for date also. That means if the baby is more than 4 kg, then we say that they are large for date. And term neonate or term delivery means born after 37 completed weeks of gestation and up to 42 completed weeks of gestation. So 37 to 42 weeks of gestation is normal or term neonate. And preterm means born before 37 completed weeks. Postterm means born after completion of 42nd week. Okay. And what is abortus? If a fetus or embryo is removed or expelled from the uterus before the age of viability, or weight less than 1000 gram when the age of gestation is not known. So if somebody is born before 28 weeks of gestation, even if it shows the signs of life, that is an abortus, right? These are simple terms, okay, and it should be understood very clearly before we start any topic on obstetrics. Now, a few things about the patient of obstetrics, how we designate them. So, gravida is a term for number of total pregnancies, including past pregnancies, irrespective of the pregnancy outcome. Whether it is stillbirth, whether it is abortion or neonatal death, that does not matter. We count all the pregnancies, including current pregnancy. Okay. And if somebody is pregnant for the first time, we refer them as primigravida. If she is pregnant for more than one time, she is a multigravida. And remember that gravida is used only for currently pregnant women and not for non-pregnant women, right? And parity is used for all the women, currently pregnant and not pregnant women. So what is parity? It is a number of past pregnancies. Okay, remember that it is the past pregnancy. Past pregnancies delivered after reaching 28 weeks of gestation. You have to remember this 28 weeks of gestation because this is the age of viability taken in our country. If you look into your book, it may be 22 weeks as recommended by WHO, or it may be even at 20 weeks. Okay, but for us, it is 28 weeks. And parity does not count the current pregnancy. Okay, this is the difference between gravida and parity. Okay. So gravida counts past pregnancy plus present pregnancy. It is used only for currently pregnant women, and parity does not include the current pregnancy even if the woman is pregnant right now. Okay. Nullipara means a woman who has never completed a pregnancy beyond the age of viability. Okay, she is a nullipara. Nullipara. Primipara means a woman who had delivered only once, that is more than 28 weeks, or birth weight more than 1000 gram. It is the same for all. And multipara means a woman who had delivered more than once. These are the terms very commonly used every day in Gynecology ops. Right? So few things about maternal mortality ratio. This is one of the indicator, country indicator. Okay, that is the number of total maternal deaths that result from pregnancy and its complication per 100,000 live births. For Nepal, the latest MMR is 239, and it is on decreasing trend. Okay. The numerator includes the number of maternal deaths regardless of pregnancy outcome. So it includes whether the mother had live birth, stillbirth, or ectopic pregnancy or abortion. All these things comes under maternal death. And the denominator includes live births only. But when we count the denominator, it is only the live births. Sachin, please tell them to put on their video. Okay, otherwise they are not counted as being in the class. Please.
video on गरिदिनु है प्लिज है
Why you put your video off? Okay, your attendance will not be counted if you put your video off. Okay, that means you are not attending the class if your video is off. I don't know why. Okay, only showing the name or showing the photo will not count your attendance. Sachin, please, right? If somebody is totally keeping their video off, that means they are not attending the class, and attendance is very important. Okay.
okay
And you keep watch on everybody. Okay, I'll also randomly see them.
okay
Whose front camera is not working? Why? You should be prepared for the class, right? So if your video is off, that means I think that you are somewhere else and you have just joined. Okay. Now, this history taking and examination format, and you all know that in clinical medicine, how important is history taking and examination, right? It will give you the diagnosis and provisional diagnosis, and the investigations we do only to confirm or rule out some diagnosis. Don't think that investigation will give you all the diagnosis. Okay, you have to know how to communicate with the patient and how to take accurate information by accurate history taking. Okay, if your history taking is wrong, that means your diagnosis is going to be wrong and your treatment is going to be wrong and your purpose is not fulfilled. Okay, so we have a format for history taking in Gyne and Ops. It is somehow similar in all the departments, but in Gyne and Ops we have more focus on this menstrual history and obstetric history. All others are same. A few things may be slightly up and down, doesn't matter. Okay, but the overall format is same for everybody. So first heading is patient particulars. Here you have to mention the patient number if there is patient number, inpatient or outpatient number, so that we can check which patient you have taken, right? And the name of the patient, it is important for record keeping and to be familiar with the patient. If you take the name of the patient, she feels close to you and she will share her important information. And also to see the ethnic group. If you see the surname of the patient, you can make out which ethnic group she belongs to. And age is important because the disease pattern varies according to the age. So in gynae especially, if she is very young, her disease pattern is different from the reproductive age group and from the postmenopausal or older age group. So age is very important. Marital status, whether she is married, widowed, divorced, separated, or single. Educational status, because you can communicate with the more educated patient more effectively. And you have to be you have to use very simple language if she is not educated. Okay, even with laymen, we need to uh, comprehend in very simple language. And religion, because some of the religious these procedures may be related to some of the diseases. Okay, we will be discussing this in detail in your clinical posting address, whether she comes from nearby area or from far area. This is important for geographical area also, and for whether she can come for frequent follow-up or not. And occupation is important of even the husband or partner and herself, because some of the occupational diseases may be related to this. And socio-economic status, you can just ask few questions. You don't have to ask what is your salary or like that. Okay. Now, coming to history taking, another heading is chief complaints and duration. In chronological order, you must be knowing what is chronological. Chronology means time, with relation to time. So, if she has multiple complaints, you can write the first complaint first and then other complaints, and you have to always write the duration. If she has pain in abdomen, write the duration, whether it is in 2 hours, 3 hours, or days, or months, or years. Okay, this is very, very important. Okay, only writing the chief complaint is not enough, and you should always link them with the duration. And if she has multiple complaints, write them in chronological order, first come, first basis, right? And then another heading is history of presenting illness, or HOPI in short form. Even if you write HOPI, don't say HOPI or HOPI when you present. Okay. So what is history of presenting illness or history of chief complaints? That is the elaboration of each chief complaints in detail to reach a provisional diagnosis. So this is the main important part of history taking. This is history of presenting illness. If somebody has, for example, if somebody complains of pain abdomen, you have to describe the pain in details. Where is the pain? How is the pain? How severe? Aggravating, precipitating factor, etc. Okay. And if she has cessation of menstruation, you have to describe that in detail, especially in obstetrics. When is her last menstrual period? What is her gestation age? Whether she has done pregnancy test or not? Whether she is having pregnancy symptoms or not? All these, each chief complaints should be elaborated in this history of presenting illness, right? Now, after this history of presenting illness, we go to obstetric history. That is history of previous pregnancies, right? So we start from the duration of marriage. Okay. So married for how much duration? 1 year, 2 year, or many years? If it is long duration, when the old woman come, then they are married for a long period, then you should write the age of marriage, whether she was married at the age of 16 years or 18 years or 20 years. Okay. And if they are recently married, you just write the duration of marriage. And then, as we have already said, if she is currently pregnant, you mention the gravida. For all women, you mention the parity. Okay. And you also mention the number of abortions she had, whether it was spontaneous or induced, and what was the duration of pregnancy when she had abortion, and then complication in those pregnancies, living issue, how many living issue are there, because some of the women may have delivered many children, but living maybe only one or two. So you should mention the living issue also, and year of last delivery. Also, you should mention type of previous delivery, whether it is normal delivery, instrumental, or cesarean section, and also in case of previous instrumental or operative delivery, you should mention the indication why it was done, right? And if there is any significant antenatal problem, antenatal means during pregnancy, okay? If she had pregnancy-induced hypertension or diabetes or antepartum hemorrhage at that time, all these terminologies we will be coming in later classes, okay? So if she had any problems during pregnancy, you should mention it. And if she had third stage, means after delivery of baby, if there is complication in third stage, means retained placenta or postpartum hemorrhage, you should mention it. If she had prepuceral complication in previous delivery, like prepuceral pyrexia, then also you should. Some students are joining now also. Okay, are they allowed to join after such a long time? I don't know. And where they delivered, year of delivery and place of previous delivery, sex of the baby, living or stillbirth, weight of the baby, and if there is neonatal death, you should mention the age of the age when death occurred and cause of the death, if not, if known. If there is gross congenital malformation in previous babies, that should also be mentioned. So there are lots of things to be taken in history, right? Now coming to menstrual history, it starts from the age of menarche, okay, or it is denoted by K. K means catamenia, that is first menarche. When did she had her first menstruation? Like it can be 13 years, it can be 14 years, 15 years, like that. Okay, it starts like that. And duration of flow, you will mention in days. Okay, whether it is 2 days, 3 days, like that. And length of the cycle is from first day of one cycle to first day of another cycle. Okay, so we keep the days of cycle in upper part, and in lower part we keep the length of the cycle. Okay, that is how you should record, like 3 to 5 days flow by 30 plus minus 4 days. Okay, this is the example of a normal cycle. And whether it is regular or irregular. If it is regular, then you mention regular cycle. If it is irregular, then you should mention the range of shortest cycle and range of longest cycle. Like here, 40 is the shortest cycle, 90 is the longest cycle, 40 to 90. Okay, and you should also mention the amount of flow that can be asked by number of soak pads per day. Okay, if she is having lots of soak pads per day, that means she is having heavy period. Okay, and passes of clots also denote the heavy flow. And dysmenorrhea, whether it is present or not, if it is present, what is the severity, what is the duration of dysmenorrhea? Dysmenorrhea is painful menstruation. Okay? And intermenstrual bleeding means bleeding in between two menstrual periods. And postcoital bleeding means if she had bleeding uh, after the sexual contact. Okay, that also should be asked and mentioned because it can denote serious diseases. And it should end by mentioning the last menstrual period. Okay, normal last period, LMP. Okay, and if she is menopausal, if she is no longer having period for last 1 year, then ask about the duration of menopause, for how long she is not having period, and also ask whether she is having any bleeding after the menopause. Okay, some women can have bleeding after 2-3 years of menopause. That denotes some abnormality or disease. Okay, so this is the menstrual history, and for each patient you have to mention all the details. Okay, so by practice you will know how to take it quickly. And then comes the contraceptive history. This is the type of current or most recently used contraception method. So it can be oral contraceptive pills or barrier method or Depo-Provera or implant or IUCD, anything. Okay, and you should not forget about the natural method also. Some women will say that they are not using any contraception, but they may be practicing some some natural method like coitus interruptus that will be discussed in later classes. Okay. Duration of the current use of contraception, if they have discontinued, when they discontinued, and reason for discontinuation. Is it because of side effects, or is it because they want to conceive, or like that? Okay. And date of discontinuation of the contraception, and date of last dose of Depo-Provera if they were using Depo-Provera, because Depo-Provera is a depot preparation. So even after stopping, there will be effect of Depo-Provera. Okay. So this is about contraceptive history and past history. Important things to mention is past medical and past surgical history. Right? Past medical history means history of diabetes mellitus, hypertension, tuberculosis, asthma, thyroid disorders, any history of blood transfusion, or any other significant illness in the past. Right? You cannot ask all the diseases in the world, but you have to ask about these things, okay, because these are important. And surgical history means history of surgery, whether it is minor surgery or major surgery. When did that occur? What was the type of or name of surgery, and what was the indication of surgery? Okay, not only gynae surgeries, it means all the surgeries from head to toe. In family history, you have to ask about tuberculosis, diabetes, hypertension, because they can be hereditary, and also ask about female genital tract malignancy. And the question is, who is the family of that woman? That is first degree relative of her maternal family only, okay, not the husband's family. In antenatal cases, you should always ask about, this is also about the first degree relative. I think you know what is first degree relative. Okay. You should not mention about, like very far family members. And you ask about occurrence of multiple pregnancies, gross congenital anomalies like Down syndrome or anencephaly in the family. In personal history, you have to ask about smoking, duration of smoking, number of cigarettes per day, and alcohol intake, how much alcohol she is taking, and history of allergy to anything or any drugs. Okay, treatment history, any treatment done for present illness or any medication which the patient is taking regularly, because that is important for our treatment. Okay. In physical examination, I'll be just mentioning all these things because that will be taken in detail in your clinical posting. You have to mention the general condition of the patient, whether she is ill looking or healthy looking. You have to take her height and weight if it is not taken already. And there is cardinal signs, that means you have to check for pallor, edema, icterus, cyanosis, clogging, and lymphadenopathy. You have to take the vital signs, pulse, blood pressure, respiratory rate, and temperature. Thyroid you have to examine, breast you have to examine if the patient allows or if there is senior present around, and cardiovascular system, heart sound and murmur only we are not doing detailed examination. Respiratory system, breath sound and added sounds you have to mention. Okay. And abdominal examination and pelvic examination is very important in obstetrics and gyne. On inspection of abdomen, you have to notice the contour of the abdomen, any scars present, pigmentation, linea nigra, stria, venous prominences, the condition of umbilicus, hernial orifices, movement with respiration or any visible obvious mass. In palpation, tenderness of the abdomen, organomegaly, abdominal mass, raised temperature, guarding and rigidity. And if there is lump in the abdomen, you have to mention all these details. Okay. And percussion, you have to do sometimes to notice the fluid, gas, mass, and organs megaly. And auscultation, you have to auscultate the bowel sound. Okay. And obstetric examination, antenatal examination, Sachin, you will join, no? Because the time left is only 1 minute and class is not over. Sachin, where's Sachin? Huh? Okay, after the class is over, after this time is over, everybody rejoin in the same link, okay? Obstetric examination is done in supine position with slightly flexed thighs and knees. And you have to notice the fundal height. These things will be done in detail, and you will be done demonstration also. You have to measure the fundal height, that means the size of the uterus, abdominal girth measurement, fundal grip, lateral grip, first and second pelvic grip. These examinations